Welcome everybody. We are going to get started in 1 minute with the webinar. While you're coming in, feel free to put your name and where you are joining us from in the chat to say hello. Welcome, everybody. We're going to get started in just a few seconds. We'd love to say hello. Please put your name and where you are joining us from in the chat. Good afternoon, everybody. Thank you for joining today's webinar, Investing in Local Networks and Initiatives Led by Family Child Care Educators. Today is a conversation between National Association for Family Child Care, researchers, funders, and amazing leaders who fulfill the role of both running home-based child care programs while also supporting local networks and groups of their peers. My name is Erica Phillips. I am the Executive Director of the National Association for Family Child Care. We are so happy that you've chosen to join us this afternoon. We have a great webinar lined up with a packed agenda, so we're going to jump right in. This webinar will be recorded, so it will be accessible after today. First, we want to say hi. If you're just joining us, feel free to say hello by putting your name and location in the chat. So we're going to move along with our slides. Today, we're going to start with an overview of research on home-based, overview of research on networks led by home-based child care educators from Juliet Bromer at the Erickson Institute. Then we'll have a moderated panel with two amazing home-based child care leaders, Banu Chabra and Arlene Lambert, along with program officers from foundations that invest in their work. We are grateful for all of our panelists for joining us today. If you're here, you're likely well aware of family child care, also commonly referred to as home-based child care. However, to ground all of us here, there are 12 million children in home-based child care between the ages of 0 to 12, making this the most common child care arrangement, particularly for infants and toddlers, children from low-income families, immigrant families, families of color, as well as families living in rural communities. There are over 5 million home-based child care programs spanning the spectrum of care from family, friend, and neighbor to small and large licensed home child care programs. This is a critical segment of our early care and education system that is often overlooked and under-resourced. Since 1982, the National Association for Family Child Care has existed to empower a nationwide network of providers and partners in expanding and promoting the power of family child care. As the largest national association for family child care, we promote quality reflective of diverse, dynamic early childhood professionals and support all who care for, educate, and work on behalf of young children in home-based settings. We provide opportunities for family child care educators to grow their knowledge and businesses through membership. We offer high-quality professional development, tailored and accessible to those who work in home-based environments. We also run the only nationally recognized accreditation program focused on family child care, a stamp of approval that's a cornerstone in many state quality systems. Finally, we aim to advocate for the needs of this workforce through policy and partnerships. You can find the impact of some of our work in a report that we'll drop into the chat. Today, we will use the term home-based childcare as many of the local networks and associations we're discussing today represent the spectrum of care in a home, from a family, friend, and neighbor to a small, enlarged, licensed home childcare program. Before we dive into the research and our amazing panel, I want to just share our why for why we care so deeply about investing in local leadership for home-based childcare. Although there has been a decline in the number of licensed family childcare programs, educators who remained open have been asked what supports help them stay in the field in research. And the most frequently cited support was peer support, including informal networking or friendships, and more formal peer support groups or state and local associations. They are able to provide the resources, connections, power building, as well as moral support that is needed to stay in the field. NAFCC has a critical role and deep interest in sustaining these peer support groups and building leadership, which will ultimately lead to an increase in the number of home-based childcare programs, ensuring all families have access to this type of childcare. Over the last 2 years, we have doubled down our efforts to support home-based childcare leaders and their work across the country. This includes Leader Shaping Leaders, a year-long leadership amplification program that has supported over 75 leaders. We relaunched our affiliate program to provide more support to networks on the ground. And we're excited to have recently launched our leadership map, our family childcare leadership map, which shows leaders across all aspects of NAFCC, including state representatives, the Accreditation Council, affiliates, policy fellows, and NAFCC's own board of directors. Without further ado, I want to turn it over to Juliet Bromer from the Erickson Institute, who will walk us through some of the research on leadership, peer supports, and home-based childcare. Juliet is a friend of family childcare, a research professor at Erickson Institute, and somebody who cares deeply about home-based childcare. So we'll turn it over to Juliet. Thank you for joining us here.
Thank you, Erica. Oops. Thank you, Erica. Can you see my slide?
Yes, we can see.
Wonderful. Well, thank you for being here. I'm just going to talk for a couple of minutes to give some findings from research to sort of set the context for the discussion that we're going to have. And really to continue to answer the question that Erica just raised and talked about, which is why invest in educator-led, provider-led networks for home-based childcare. And the simple answer, it's not simple, but the answer is educator-led networks are rooted in peer support, and we know peer support has many benefits. So I'm going to talk a little bit about what do we know about peer support from research. Some of this you can find in this brief that we put out with the National Center on Quality Assurance last year, but peer support is defined as a relationship-based strategy where individuals with similar lived experiences listen to, share with, and encourage each other. And peer support has long been recognized as a strategy for improving well-being across fields in mental health, and parenting, because peer support builds social connections, especially for groups who may feel marginalized or be marginalized. Peer support is distinguished from other types of support, and that the source of support is someone who shares personal experiences, professional experiences, or both, and can offer understanding and validation that may be lacking in other types of professional relationships. Research on peer support in related fields of health and mental health services finds that peer support contributes to emotional well-being, enhanced self-efficacy, empowerment, and increased social support among mental health and healthcare providers. Sorry about that. I'm sorry, there we go. Sorry. So let's now talk about peer support in family childcare initiatives and what it is. So peer support in family childcare is where educators share their successes and their challenges, their knowledge and their skills. And this may happen across many different types of organizations and platforms: staffed family childcare networks, provider and educator-run networks, family childcare associations. We have many words for these entities in our field, but what's more important is what happens. And so the kinds of things that the kinds of activities that really embrace this idea of peer support are mentoring, one-on-one mentoring or peer groups, apprenticeships, communities of practice, facilitated cohorts, support groups, social media and text groups, networking meetings, or grassroots networking, to name a few. So, I'm sorry that my slides are not wanting to advance. Oh my goodness. Okay. That's not the slide I want. There we go. Okay. So a very small body of descriptive research points to the promise of peer support to sustain and support quality and sustainability in the home-based childcare sector. So I'm going to share some of this very preliminary research. Really, we don't have a body of research on this. So this is like pulled out of the few studies that are out there. So first, we know that home-based childcare educators who are engaged in some sort of peer support network or association report experiencing fewer feelings of isolation, increased social networks, and one study found that providers who had someone else to talk to, like themselves, who was another family childcare educator, were less likely to consider leaving family childcare. So there's some evidence of what Erica was talking about. Peer support can also help educators engage in publicly funded systems, may help them complete licensing processes and run successful businesses, especially in that first year, which is so critically important to sustaining a business and can be such a hard time for new educators running a business. Quality improvement. Peer support strategies such as facilitated cohorts around a specific topic may lead to increased knowledge, enhanced practices. And one study in Arizona of the Family Friend and Neighbor Kith and Kin Project found that providers who participated in facilitated support, children in their homes had improved outcomes around literacy. It was a literacy-focused intervention. And then finally, leadership. Peer support can really encourage educators to become leaders, to step into those leadership roles, especially for those who have historically been excluded from systems, policies, and leadership and advocacy. And that while we need more research, I think we know enough about how important peer support is that this is something we haven't invested in as much as other strategies in the field, but that it really has the potential to increase equity across the family childcare field and increase those social connections. I'm going to end with some data from a recent survey we did of home-based childcare networks across the country to really show the power of educator-run networks. And when I say educator-run networks, that's a term we use to include associations, anything that is developed, started by, led by, run by educators. So in a survey of 61 networks across the US, we surveyed both educator-run networks and other types of networks that are not run by educators. And in our comparison, we found that there were things that educator-run networks were significantly more likely than other networks to do. And now my mouse is not going to work. Wow. All right, well, my mouse is not working to advance these animations, so I'll just read it to you. I'm sorry. So first, we found that, there we go. Provider-run networks are more likely to include educators as equal decision-making partners in governance, operations, and service delivery. They were more likely to have a mission statement focused on supporting home-based childcare that guides their work and their supports for educators. and they're more likely to support educator-led advocacy by enhancing educator skills in organizing and implementing meetings and actions. And they're also more likely, and it's not on here, to hire, to have more experienced educators mentor less experienced educators. And so the takeaway here is really that there is great promise in peer support as a strategy, but there has not been the promise of investment. And we really need investment in intentionality around this strategy, and also in research to understand how it works and why it works, and what are the elements, what is it when it works well, what are the elements that make it work well, so that we can expand this and really, as Erica said, help build back the supply of home-based childcare in the US. Thank you.
Thank you, Juliet, for providing that grounding and I think some of the best research that we do have. We need more research, but some of the best research that we have on home-based childcare, on the importance of peer supports in ensuring that every educator who is doing this work has a community that is able to address and understands the experiences. So we are going to move on to our panel, which we are very excited to have here today. We have 5 individuals who will be joining us for our panel. That includes Banu Chabra, who is the president of the Bay Area Professional Family Childcare Network, owner of Banu's Preschool, and a member of NAFCC's board of directors. In addition to that, Arlene Lambert, is joining us. She's the president of the Florida Family Childcare Home Association. She ran and operated Arlene's Home Daycare Incorporated in Florida, and is a state representative with NAFCC. We have Marika Cox-Mitchell, who is the VP of Early Childhood at the Bainham Family Foundation. September Jarrett, who's the program officer for the education program at the Heising Simmons Foundation, and Nara Top, who is a program officer at Kellogg Foundation. So we'll bring you all here to the virtual stage. Thank you all for joining us for today's webinar. It was really important to show the partnership between foundations, like the ones that you are with, really leading and supporting, and of course the voices of family child care leaders who are doing this work. And so we're going to start out by hearing from both Banu and Arlene. So for both of you, I want to ask a little bit more about the organizations you lead, if you can talk about their mission and what services and programs do you provide. And as you're speaking, just for a second, we'll show a slide that includes some data about your organizations. And I will start with Banu. So Banu, can you share with us about the organization you lead, your mission, and the services?
Hello, everyone. Thanks for joining us today. So our organization is called the Bay Area Professional Family Childcare Network. And the mission statement of our Bay Area Professional Family Childcare Network is dedicated to supporting family childcare providers, educators in California and beyond, reach higher standards consistent with current research in the early care and education field by providing resources, information, and training to enhance a safe and healthy home environments for children and the families we serve. Our organization is also a vehicle for developing a sense of community among family childcare providers, educators, by providing peer support and camaraderie through various programs and activities. We are also 501c3 corporations. Thank you.
Thank you, Banu, for sharing about the Bay Area Professional Family Childcare Network. Next, Arlene, can you talk about the Florida Family Childcare Home Association, the mission, and the services and programs that you provide?
Thank you for asking, Erica. So our mission statement here at Florida Family Child Care Home Association is to represent a united voice on behalf of all children to promote and encourage quality professional child care professionals through education, legislation, and advocacy, because we believe that those three content areas really will support us as a peer group. FFCCHA was founded by a few family child care providers who believed that they had a need for a community. So FFCCHA is truly grounded in peer mentorship. As for our association, we have over 650 plus membership. We have an accreditation project program. We have a mentorship program. We also do a lot of professional development, both for our board as well as for our membership at large, because we are really committed to providing a community of excellence for our family home educators. And we are also an affiliate of NAFCC.
Thank you, Arlene. It's been an amazing partnership with the Florida Family Child Care Home Association, as well as the Bay Area Professional Family Child Care Network. Benu, did you want to add anything about some of the services that you're able to provide in the Bay Area?
I just want to say that, we do peer-to-peer support, like, for example, we do Tuesday talks. We meet first Tuesday of the month. Before COVID, we were in person, and after COVID, we've been meeting, via Zoom, where during COVID, we were even able to bring in over 200 members and the people who can join us. And we do networking, resources, assistance, privilege on our private Facebook group, virtual and in-person home tours, and also training, webinars, conferences, and professional development opportunities, and also one-on-one support as needed. And I think it's very, very important in our field, in which we're doing it because of the grants that was given. So thank you.
Thank you, Benu. I've had the pleasure of being on the ground at events that both of your organizations have hosted. And there's just a really palpable feeling of community, of professionalism, of growing together, of supporting families. So thank you all for all that you do. Nara, I want to bring you into the conversation. And just to frame us a little bit, Kellogg is really prioritizing home-based childcare. You could talk a little bit about why that's so important, and then also the role that you see investing in family childcare leadership and the overall ECE system transformation.
Sure. Thanks so much, Erica, and a warm hello to the 192 people that are joining today. It's been so exciting to see the group grow as we kick off this webinar. So that's a great question. I think you did such a good job of elevating how important family child care is in your opening remarks. It's the most common type of child care in the United States. It's a critical part of the child care ecosystem for so many of the reasons that you mentioned earlier. Parents prefer a home-like setting. There's a mixed age care model, and I really want to emphasize how important family child care is to the littlest children, to babies and toddlers. And home-based child care also offers cultural and linguistic diversity. So this is a really important choice for parents to have. To help their children thrive, to help them have peace of mind while they're at work, and to help support healthy communities. So I guess I would just say, in short, family child care or home-based child care is a critical part of the overall ecosystem of child care in the United States. And in thinking about the networks and leadership like NAFCC, I think it's an example of where leaders can come together to advance collective action that has the potential to spur more equitable and human-centered changes to the early childhood system in the United States.
Thank you, Nara, and appreciate the grounding around home-based childcare, and also how the leadership investment really is key to the strategy that Kellogg has adopted. And so thank you for sharing that. So we also have Marika in September here, who partner with many home-based childcare-led networks, including Arlene's and Banu's. And so I want to ask you all, why is investing in local educator-led networks an important part of your funding strategies? And I'm going to start with Marika first.
Sure. At the Bainham Family Foundation, we are committed to the well-being of children and families, and our early childhood work has 5 focus areas, including early learning and family childcare. No doubt is an early learning setting that families want and need. Our family childcare partners drive our investment strategy. They often report that they are isolated, they are invisible in policy making decisions. There's a mistrust between them and, frankly, the government. In many cases, they often report that they're under-resourced. And so networks or coalitions led by family childcare professionals are key to addressing these pain points. We're able to see through our partnerships with coalitions led by family childcare professionals how networks can create that needed sense of community that prevents the isolation. Networks, we support, advocate with others to increase investments in the childcare sector as a whole, but specifically family childcare. Networks we support are able to build trust. Often family childcare professionals are apprehensive about accessing public or private funding, even when they're eligible, and their apprehension is valid and rooted in their past experiences. And networks are able to build that trust and serve as an intermediary between family childcare professionals and public and private funders. So that's really critical to the work that we do.
Thank you, Marika, for sort of seeing that connection, and that the networks that you're working with can be the intermediaries between an organization like the foundation systems and the actual educators. September, the same question to you. Why is this a part of the strategy for Heising-Simmons?
Well, a good hello to everybody, and what a great panel. Hard to follow. I'll just triple click on most of what's been shared, both the evidence from Juliet and the good perspectives from all the speakers that have been ahead of me. I'll say for the Heising-Simmons Foundation, where I serve as a program officer, I want to start with our North Star goal. Our North Star goal is early childhood systems in which children, families, and providers all thrive. And we can't create those systems that are equitable and ensure thriving people without centering the expertise and the knowledge and the wisdom of the providers themselves. Full stop. And so that is where our grant making really tries to take a focus of really centering the impacted communities and the most expert communities when it comes to children's development of the parents and providers. And I would be remiss, and I didn't tell her I'm doing this, but Marika wrote a piece for NAFCC back in 2019 called Flipping the Script, about providers and practitioners or educators driving public policy. Too far, we have too often the think tanks, the researchers, people furthest from the children and with the least expertise driving our systems. And we really heard that call and said, when we were working on workforce reform strategies, and we said, wait, how many providers and provider experts are advising us? Where is our money going? What do we need to do? And that really was a wake-up call. That article that I'll pop in the chat, that sort of lens and expertise was like a good call to action. And we've been ever so increasing some of our investments. We seeded a fund. Once we started looking around, we realized we weren't alone, that there was so little investment in the sector, and thought it was important to not only move our dollars, but create proof points with other funders. And so we're proud to have been the lead funder of an effort called Practitioners Voice California, which is funding practitioner leaders from home-based providers to center-based teachers, really making sure that our philanthropic dollars are seeding and leading the practitioner leadership that's needed. And I would say this work is exceeding our expectations. What practitioner leaders, when they're seen and resourced, can impact and do, and the change they're leading is nothing short of transformative, and a great investment. I would say, given the recognition, the fact that we're having this webinar and the leaders in this conversation and in this call shows us we're making progress, and yet there's so much more to do. One thing that we work on, and we're pleased to work on with Kellogg, is governance. How are early childhood systems governed? And are we getting beyond a one and done or an occasional consultation of an Arlene or a BNU when a policy or a practice decision is being made, but actually creating governance systems at which provider leaders and home-based provider leaders are at the table and making the decisions about the systems that impact them in their lives. So our why is strong, and there's a lot more work to do and do together moving forward.
I love just spending time just listening to both Marika and September. I just all day weekend love that. The call out to Marika's paper on this is incredibly important, and I think highlighted some gaps in the space. And September, thank you for bringing that back to light, and also talking about the steps that the foundation has made to respond to that. So, you know, we're talking about really great investments, decisions that support the mission or the vision that we all have, but it's not all roses. We know that. And so, Arlene, I want to come to you. What challenges have you experienced in being a educator leader, and how would you like to be better supported?
So, great question. One of the things that I have found over the year, it has gotten better. It's that we were never looked at as business owners. And I do believe that some of us as early educators looked at ourselves as educators. But first, we are business owners because without the business, we cannot educate children. That's one. Second, some of the challenges that I incur is the intentionality of us, even when we sit at the table. I know I had shared the story with Erica, and I would like to share it with everyone because in so much, I attended a conference and I was so excited to get into a space where it was just all for family home. It was the first time that I attended a conference with agency personnel, and it was all about family home. I was excited. I got into the room, and when it was time for the family home provider, which was just me, to speak, everybody else wanted to speak for me. And I had to literally say, stop, wait, give me a minute. I am the family child care professional in the room. May I please represent myself? And I say this, I would like to share the story to say, if we don't raise our voices, and if we're in the back and having other people speak on our behalf, if we are not intentional when we are in a space that our voices can be heard, it will be subdued unintentionally, because in the past, it has always been someone else speaking for us. So here at our association, one of the things the board and I are very strategic on is how are we building capacity with leadership? because we don't need a high and low. I am the president now, and this is my mission. But we are definitely bringing all our mission to the alignment of FFCCHA mission, right? Which is to be the very powerful voice for children, as well as to lead education, advocacy, and a legacy. We have a couple of issues in Florida. We have spaces where there are childcare deserts. We are not waiting on other organizations to lead that out. We are going to lead that out because we can facilitate that to have small family home childcare programs within those deserted areas. We understand that home-based programs provide high quality and produces a lot of pre-educational systems that are very promising when children get to the education, the K, all the way up to high school, because we provide continuity of care. I believe that we need to extend our leadership. We need to show ourselves as co-collaborators in the partnership of creating that landscape for early education that filtrate through to the school age. So what we have done, we have looked at our data, we have done our research. We saw what our members are looking at, where we lack. And we are trying to navigate the lack to where we need to be to provide that services for our family childcare home professionals, not just the current, but the future. Because we cannot only think about ourselves in the moment, but how is the work that we are matriculating currently, how is it going to be actively bettering our future? How is that going to look? What is the landscape and what does the shape look like? So it is an uncomfortable situation because we are out of our comfort zone and we are utilizing our resources, the partnership, the opportunity that Marika is presenting from the Bainham with us, and all these other agencies and organizations who are looking in to support our association for a better landscape for our educators who are first and foremost business owners. So I believe we need to really look into ourselves and understand, first, we are business owners, second, we are educators, and we need to lead the charge when it comes to advocacy for our field.
Thank you, Arlene. I see a lot of hearts and claps, and I love the co-collaborator because that is true. Family child care educators truly do think about the whole child, the whole family, and should be tapped in that way. So I appreciate you for doing some of those uncomfortable stepping out pieces. So Benu, recognizing that this webinar is in the middle of the day, and part of that was because we wanted to have an audience for people who generally work 9 to 5. I do want to ask, how do you balance being an active educator with leading peers? What additional support would you like to have in being the most effective leader in doing your work?
Thank you so much. So time managing, we as an educators, right? Family childcare educators, we know how to manage our time. Even though at tough times, we survived during COVID and we're still going, right? So, having like a prioritizing your tasks, like, if providers in our network, they know they can talk to me early in the morning or late in the evenings or on the weekends, and also, with me, myself running my business, which I've been doing for my home for 24 years now, having that, like I knew I had a webinar today, so I already did the circle time, the artwork, got the lunch ready this morning. So, and also doing the like a time blocking, like if I have a meeting, just doing during nap time or like, after hours, and also having that transparency between us, as an educators, having that schedule responsibilities and also seeking feedback, like what can I do to do this better? And I know the self-care. That's what I have to work on myself. But we can't stop right now. And I saw in the chat somebody was talking about having the how to like connect and stuff with the cities, so we got to have a seat at the table. So show up in our city meetings, and building those relationships, family childcare educators, who knows, building relationships and building that trust, beside us. Like, for example, like we start that building relationship as soon as the baby walks in with their families, they come into our homes, right? Our doors are open for them and they become our extended family. So I think I would say the key is building relationships, having that peer support with one another. Like everybody here on the panel talked about that, and that is very, very important. And checking back with one another. We all know that the family childcare is a very, very isolated profession, but when you have that support, that you can lean on somebody, who went through it, then that we have our village, and it does take a village to raise our children, to serve our community, our families, our children, who are our leaders tomorrow. So thank you.
Thank you, Banu. Thank you for your amazing commitment and leadership. And we do need to keep an eye to self-care, and we cannot burn out doing the work and also leading around the work. We generally try to do most of our trainings in the evening and weekends, but I want to bring September in to talk about what have you learned about investing on the other side, about investing in educator-led networks.
Yeah, thanks so much. And I see a San Francisco friend, Oscar, in the chat, who he and his San Francisco work, that's where I'm talking to you from. And I've had an honor of supporting our Family Child Care Association and leadership for decades to just say, like, what have I learned? So much and continue to learn. There's 3 takeaways I guess I'd offer to the experts gathered here. First, this is a huge field. There are hundreds and thousands of Arlenes and Bainus throughout the country who are leading the way and need our support. Today's attendance shows that. To give you an example, when I put in a chat this Practitioner's Voice California, it was an open call opportunity for provider-led organizing and leadership. We got 6 applications for every 1 grant we could fund. And that was a first-time effort. I don't think we knew even who to reach out. When you don't know what you don't know, I'm sure there was probably more than that. So just to give you an example, there is so much need, potential, in leadership to water and fund. Second, when you find those leaders and allies and the associations in your ecosystem, there's a huge return on investment. By design, home-based childcare leaders make magic happen and a lot happen with and so dollars go a long way. You saw the budgets on the screen that were shared for Arlene and Binu's organizations. Those are small budgets with a lot of members and a lot of impactful work done. So every dollar shared and invested is well used in this sector. Third, and this is with humility, I'll say, building and sustaining leadership and networks takes time. Multi-year steady support is key. And we're still making our lessons, sort of creating this California example I lifted up. It wasn't done yet. People were only comfortable joining us for 2 years. It's really 5 or 10 years worth of work that needs to be funded. So long-term, patient, generous funding is really, really critical. I would just also offer to my funder friends in the field, I'm following Marika, I'm following Nara and Kellogg and Bainum. Too often when funders, whether public or private, are funding home-based childcare leadership or family childcare networks, they tend to have their idea and their work they want to fund the network to do, and too infrequently say, you're a leader, here's resources for you to set your priorities and do the work you want to do. And so I would just encourage us all to take the power and the wisdom and the knowledge we've learned today and be as generous with flexible multi-year funding as possible for the leaders who are in every corner of the country doing this important work.
Here. Thank you, September, for that, and thank you for sharing the findings. 1 for every 6, or 6 for every 1 application. Wow, that's incredible. That was just in California, I believe. Wow. So thank you for sharing that. Nara, I want to go back to Kellogg, and Kellogg is a funder for our leadership development program, Leaders Shaping Leaders, which many of the leaders of educator-led networks have participated in, or as a way to support people who want to more formalize or grow their educator network. Why is investing in leadership development so important to Kellogg?
Thanks so much, Erica. Yeah, we have been a funder of leaders, a proud funder of Leaders Shaping Leaders, and this really connects to the Kellogg Foundation's long history of supporting leadership. We have a theory for change that is grounded in what we call the DNA of the foundation, of our commitment to racial equity, racial healing, community engagement, and leadership. And each of these approaches is complementary and interconnected toward our North Star of achieving equitable communities in which all children thrive. So this effort of NAFCC is really deeply connected to the values of the foundation, where we really see that those closest to educating children, family child care providers, are the leaders of system transformation that will be both meaningful and enduring. So I think this very much harmonizes with the idea in flipping the script of really holding the leadership of those closest to educating children in the transformation of the system.
Thank you, Nara. Marika, I want to ask you a question, and also there's a comment in the chat that was asking about some clear action steps. And so thinking about that, if you are a funder or a partner that wants to support educator leadership, what steps would you recommend?
I'll say first, recognize that family child care and their leadership are critical components of the nation's child care system. And that recognition is important. The data shared earlier reinforces that. Like Arlene said, I think coming with a lot of respect. It's not sometimes what you do, is how you do it. Respect family child care professionals as experts in their practice, both education and program administration. I highly recommend that other funders reinforce. There is likely family child care leadership already in the communities that you want to reach. Don't assume that it's a blank slate, and start with what exists and reinforce that versus going for a new shiny thing always. And prepare to reimagine. Family child care professionals in the leadership have been very clear about what they want and need. And funders have to stop loving the problem and asking them to sort of repeat that for the 10th time. Be prepared to use your social and political and financial capital to make their ideal real, and be prepared to challenge the status quo and just reimagining what childcare could be based on the expertise of family childcare and their leadership. And you'll definitely get your return on investment, because that's important to funders, and it'll be outsized. The return on the investments and partnerships we have with our family childcare organizations and leadership, it's completely it outpaces any outcomes we imagine, whether it's FLACI or DC Family Childcare Association. So just be prepared to recognize, respect, reinforce, and reimagine, and you'll get your outsized return on investments. It's a lot of R's. I tried.
Thank you, Marika. And Arlene and Bennu, I want to close, or if we have time for some questions, but really close with both of you of hearing, if you are an educator who wants to play a larger leadership role, what are suggestions, the first steps that you would encourage somebody to take? And Arlene, do you want to go first?
Okay, I will. First, join our association, Florida Family Child Care Association. There is power in the people. There is power in the network. Like Marika just says, join an organization that has already existed and have tested the sense of time. Our association has been around for the past 30 plus years. So we do have skin in the game. We have a lot of expertise. I was on the board for probably 12 years before I became president. And over my lifetime of being an early educator, which I've always saw myself as a business owner, I leaned on FFCCHA. When I attended the first conference, that's when I realized this is so much bigger than I am. And with all these other home-based owners, our voices are much larger. We can have a bigger plane. We create a system, and we can work together and matriculate our voices throughout the state. Hence the reason why we were so intentional about being an affiliate of NAFCC, so that we can join and create those chain links that will allow our voices to be heard on a bigger scale, because we cannot do it by ourselves. It is important that we connect with each other as home-based owners, connect with those and collaborate with partners like all these agencies and organizations that are supporting us both financially, with education, with data. You know, data is very important. That's something I know in the past I wanted to put to the side, but we have to look at the direction, the trajectory in which early education is moving forward, and that's where we need to align ourselves. So FFCCHA will support every childcare professional in and out of Florida, and we are willing to work with all the rest of the childcare associations and organizations.
Thank you, Arlene. Very clear, very on point. And Banu, what suggestions do you have?
I would piggyback same on what Miss Arlene said, you know, be collaborative, you know, be part of your local, state, and national association, because that's where those are the places where the things happen. Be part of your local LPC, you know, like, or also become a mentor. I'm a California early childhood mentor. So when we go, you know, to the students come to our program for lab hours, you know, the college gives them, oh, there's a family childcare educators. And I would like to see many of us for being there. Also, you know, speaking up, showing up in your city meetings. Like, this is how we were able to change the law. We were able to pass the bill SB 234 in California, because when lawmakers begin to understand the many aspects of the educators, right, of FCC, that's how they learn to, we learn to use our voices, and they know they will we need to educate, you know, our cities. Like when we showed up in our city meetings, right, we get a chance to speak like 3 minutes. When 10 of us show up to speak, you know, for that 3 minutes, we got our point across, right? For my city of Concord, now where we spend most time at, you know, when we were educating at the beginning, this was 5 years ago. We started from my city of Concord. And now guess what? They are our biggest advocate, you know, but things happen when we are together, and together we can make a big difference. Please become a voice that we need to, and also tell everyone, you know, we talk about the resources, not just for us as an educators, for our families, our children that we serve. It has to be in different languages, because look how diverse our group is. Over here, I see 182 people who are attending this webinar. If we add the experience of all these people, that's thousands and thousands. And only family childcare educators, all the educators, you know, after taking care of serving the children so many hours a day, go out and educate. We're still keep getting, no matter how many years we've been doing it, we are always wanna, you know, provide the quality childcare. We want to serve our children at the best, and this is how, you know, we're going to continue. So thank you so much.
Thank you so much. Thank you, Banu. Thank you, Arlene. Truly grateful to all of our panelists. I see in the chat from one of our leaders, Ms. Cynthia Davis. These girls are on fire. absolutely. You are on fire and said a very, very well, better than anyone else could have said, how important and valuable it is to invest in family childcare, to invest in the educator-led networks for both the educators as well as the families who uniquely rely on family childcare. So I hope that you are inspired to find ways to invest in and partner with state or local educator-led networks. Last year, NAFCC released a report on family childcare leadership, a critical solution to addressing the childcare crisis. And in that report, we did lay out 6 ideas for supporting local leadership. And I'm sharing them here as another response to what are some of the practical steps that states or cities can take to make it real. And so just to briefly say, and there's more detail if you go in that report, but first is understanding and building on existing family childcare programs and leadership. As Marika said, there's a bet if there's a community with family childcare educators, there's likely a leader who is already playing an informal leadership role. 2, making capacity building and funding available to family childcare-led organizations. The 3rd is offering leadership development opportunities and encouraging participation in professional associations. The 4th, including family childcare-led organizations in ECE systems building and beyond, and really having a guaranteed seat on any commissions or committees for educators to participate in the decision-making. The 5th is to build a big tent, to really be inclusive of all home-based childcare programs. So we know that there are educators and leaders who are family, friends, and neighbor, and who also want to participate and be a part of the movement. Our numbers are really important. And so look at some other organizations that may not be at the table, but have similar values and missions and can support all of us in having a stronger voice. And the last is engaging family childcare leaders as equal partners, building in compensation and flexibility to respect their expertise and time. And so you can read more about that. In a second, we're going to put up a poll and would just love to hear which idea would be most useful in your work supporting or investing in educator leadership. Or if you're an educator, which idea would you be most excited to learn more about? And also feel free to add any other ideas or examples that you've seen in the chat. So which idea would be most impactful in your work supporting or investing in the leadership for home-based childcare educators? It's great. See a couple of responses coming in. Thank you. We'll leave that up for like 30 more seconds while people answer. And while people are answering, I'm going to say another huge thank you to Arlene from Florida Family Childcare Home Association, Bennu from the Bay Area Professional Family Childcare Network. If you're in any of those communities, please become a member, join, support their work. And then also for our funders who joined us September from the Heising Simmons Foundation, Marika from the Bainham Family Foundation, and Nara from the Kellogg Family Foundation. Thank you for your leadership and really making this a value that you want to support and invest in educator-led networks. And Juliet, thank you so much for coming and your partnership and research and lending that and continuing to do research, right, around home-based childcare and educator-led networks. So we're going to end the poll. Thank you all for this. We will be sharing the network. We'll be sharing the recording as well as the reports that were shared here today. Really quickly before we go, we'd be amiss if we did not also encourage you to consider membership with NAFCC if you are a family childcare educator or a supporter. We have many different resources for advocates, supporters, for educators. We are also in the process of undergoing a new strategic plan, and we'd love to hear from you about what support and services you would like from NAFCC. And so we're going to drop that in the chat. Takes about 10 to 15 minutes. We would love to hear from you all as we are shaping what the future support looks like for NAFCC. Next summer, if you're in St. Louis, is our national conference. You'll have a lot of conversations like this or even more. So please consider joining us in St. Louis at our annual Family Child Care Conference. Finally, you can follow us on social media. You can reach out to us. We'll put all of our handles here. We are so excited for today's conversation and to really continue the conversation. So thank you all. Have a wonderful, wonderful afternoon.